All right, good morning. My name is Ethan Veneklasen, and I am the Head of Advocacy and Communications here at ID 2020. On Tuesday of this week, and in partnership with more than 25 individual companies and organizations, ID 2020 announced the launch of the Good Health Pass Collaborative. The collaborative is a cross-sector initiative to create a blueprint for interoperable digital health pass systems that are privacy protecting, user-controlled, interoperable, widely accepted for international travel and more. I think all of us on this call can agree that it's difficult to imagine a use case as complex and multifaceted as facilitating cross-border travel. But that's the task before us, and if we're successful here, what we learn can be applied to other use cases. We know that the effort to develop vaccines for COVID was successful in large part because of the unprecedented collaboration between the public and private sectors. And building a new ecosystem for digital health passes to restore global travel and restart the economy will require an equally Herculean effort amongst an even more diverse range of stakeholders. I am by instinct an optimist, and I'm even more optimistic today as I look at the tremendous breadth of organizations that are represented on this call. When we launched the collaborative, we had 25 organizations endorsing the effort. Today, we have more than 35, and dozens more are already in the process of doing so. We have a fantastic panel of speakers lined up for you today. This is an opportunity for us to share some more information about the collaborative, and I want to make sure that we have plenty of time for comments and questions. Each of our speakers will give some brief introductory comments, and then we'll open it up. So please, at the end, post your questions in the Q&A, and we'll get to as many of them as possible. So with that, let me introduce our panel of speakers. And then I'll get out of their way. Dakota Gruener is the Executive Director of ID 2020. Jim St. Clair is the Chief Trust Officer at Lumedic. Just one second, my screen has frozen up. Dr. John Halamka is the President of the Mayo Clinic Platform. Rebecca Distler is the Global Health Program Lead at ID 2020. Drummond Reed is Chief Trust Officer at Evernym. John Jordan, the Executive Director of the Trust Over IP Foundation. Jeff Poole is the Senior Vice President for Advocacy at the World Travel and Tourism Council. Christine Leong is the Global Lead for Blockchain Identity and Biometrics and Managing Director at Accenture. And Anne Cavoukian is the Executive Director for Global Privacy and Security by Design Center. And finally, batting cleanup, Charlie Walton. With that, Dakota, would you like to kick it up?
Sure. Thank you, Ethan, and thank you all so much for joining us here today. I'm Dakota Gruener. I'm the Executive Director of ID 2020, and it's just fantastic to be here with so many friends and collaborators. I wanted to start today by sort of grounding the work of the Good Health Pass Collaborative and the problem that we're all trying to solve. And I think I hardly need to tell anyone here on the call that the last year has been a tough one, and that governments have resorted out of necessity to relatively blunt instruments to try and prevent the spread of COVID-19. And as we look towards increasing levels of vaccination, it's very clear that we need to begin to reopen the economy, to resume travel, and to do so safely. And one of the things that we've recognized and really sort of core to the work of the Good Health Pass Collaborative is that while the COVID-19 pandemic has impacted every segment of the economy, no sector has been as hard hit as travel and tourism. The travel and tourism sector represents 10% of global GDP, and it's experiencing its single greatest shock since September 11th in 2001. We include a couple of these figures in the paper, but just to highlight them because I think they really are quite staggering. International tourist arrivals between January and October of 2020 were down by 72%. And with that, you can imagine that the revenues of every business operating in the sector were down sort of equivalent amounts. And so this has sent shockwaves through all sectors of the economy with estimated aggregate losses in the trillions. The resumption of travel is important to the global economy at large, and maybe, I think particularly of import to sort of small and medium-sized businesses. But what we also recognize is that how we go about reopening international travel is illustrative, I think, of how we're going to go about reopening other sectors. The idea behind the Good Health Pass Collaborative was, how can people prove in a verifiable, safe, privacy protecting, and portable manner that they have been tested, and have those test results be recognized and trusted wherever they go. We're already seeing countries around the world who are asking for such proof of testing as a condition of entry, and airlines and others are trying to roll out similar programs. But there's a risk in this. There are many risks in this. The first is the risk around privacy. We need to ensure that how an individual shares their data is privacy protecting. And I'm thrilled to have Ann Cavoukian here to share with us her thoughts on how this can be done in a manner that embeds privacy by design. But the second risk is one of fragmentation, and the inverse of that, sort of utility for individuals. If an individual is issued a health pass that they then can't use anywhere, it has little utility to them. And where I think we were heading, perhaps, was a world where there were multiple different implementations of these health passes without the necessary guardrails in place around some of them for privacy, and without the necessary standards in place around all of them to ensure interoperability and utility sort of wherever people might be. And so that really is the genesis of the Good Health Pass Collaborative. How can we bring together the organizations who are working in this space, either those who are developing solutions or those who are implementing them, to say we need to establish a certain set of baseline principles around privacy, around user control by individuals of their own data. And then from that, ensure that all of the solutions that are being put forward do interoperate with one another, so that an individual can get tested in one place, share those credentials as they cross a border or check into a hotel, and do so seamlessly and without hindrance. The other thing that I'll very quickly stress, and then I do want to turn it over to the wide group that we've got here today, is that there is an absolute need to be thinking about this from the perspective of equity. How do we ensure that this is inclusive? When we think about the pandemic, obviously it has had disproportionate impact on communities of color, of sort of vulnerable and marginalized communities. And I think one of the concerns that we've heard with the concept of health passes generally has been the risk of exacerbating some type of divide. And so one of the things that this group is keenly focused on is, how do we ensure that these solutions are implemented in a way that is inclusive and that minimizes inequities. And so one of the things that we actually think is incredibly important is that there is work ongoing being led by the World Health Organization on setting standards for smart vaccine certificates. And this is incredibly important work. Many of those us on the call have been participating in this work. But we recognize that it's going to be a long time before even everyone in the US, but certainly everyone globally, has been offered a vaccine. And given that, we believe that testing and vaccination will go hand in hand as important public health instruments for years to come. And so given that we need to ensure that there is alignment between what is being done and the standards being set for vaccine certificates, as well as for good health passes for testing. And so this group stands very much in support of the work being done by WHO, and is intended to be really an analogous effort on the test credentialing side, so that we can ensure alignment and standardization between both test credentials and vaccine certificates. So with that, thank you so much for joining. Eager to collaborate with all of you, and I'll turn it over to Jim St. Clair from Lumedic.
Thank you, Dakota. Thank you for that introduction, and thank you for the summary as well. I'm the Chief Trust Officer for Lumedic, and we are very proud to also be a founding member and support to the Good Health Pass. Dakota outlined many of the challenges and considerations that we feel are topic areas for Good Health Pass, which we in Lumedic are beginning to address firsthand with our own deployment of digital vaccination certificates for Providence Health Systems, of which we're a part. And there are multiple hospitals and clinics. In developing and deploying that system, we're looking firsthand at these issues concerning the ability to provide that verification for patients and recipients of the vaccines, and then the downstream implications of what that means, the ability to provide those credentials and that recognition of a vaccination for a return to normal, return to work, and return to travel. Additionally, we are also viewing the issuing of vaccination credentials as a first step to changing the relationship of the digital patient identity for the future, especially in light of the 21st Century Cures Act and the ability for patients to have access to their information. And how do we embody concepts and principles that we derive from the work in smart vaccination certificates and credentials into concepts for patients managing their identity going forward. We're very much thrilled to have the opportunity to participate and look forward to being able to advance common criteria and standards for these passes as we move forward into the future. And with that, it's my honor to be able to introduce Dr. John Halamka, president of the Mayo Clinic platform. Thank you, John.
Well, thanks so much, Jim. And so I wanted to provide a health perspective. Think of our last 10 months together as what I call the 5 stages of COVID. We started with isolation. We were worried about PPE. Where do we get masks? How do we, in effect, shelter in place? And then we started to venture out. And then we began to be concerned about testing. How do we get antigen, antibody, molecular, or other tests? And how do we do contact tracing? If we're going out, who did we contact? Then we've moved on to an era of cures. Well, can we use convalescent plasma, remdesivir, or other medications? And then vaccines. As we get to the new normal in our what I'll call post-vaccinated state, it's very clear that we're going to need a vaccine credential, some voluntary mechanism, and I want to stress that, voluntary mechanism, a tool that a person can use to attend an event or go back to work as they see fit. In my view, there will always be a choice. As we talked about, testing will continue. You might imagine that some individuals will say, oh, I'm going to get a PCR test, an antigen test, a lateral flow assay at home, and I will carry the test on my phone. That's fine. And others will say, I will get vaccinated and I will have the proof of vaccination and I will carry that on my phone. And so there was notion of the tooling so that we have non-repudiatable credentials, whether it's testing or vaccine credentialing, is so key to societal resilience and getting back to a new normal. One other thing I'd like to reflect on. Right before this session, I joined my colleagues for a national discussion of the COVID variants emerging in South Africa, the UK, and Brazil. And again, this is not, of course, to in any way panic individuals, but to say these variants are showing us that there are going to be what I'll call potentially new vaccines and new therapies needed to deal with variants. So lest anybody on this webinar think, oh, we're going to be done in 2 months. Why do we need this credential? The answer is, with the variants we're seeing emerging, this is very likely to be a societal new normal that we're going to need to carry with us credentials about testing and vaccination, not just for COVID-19, but for variants and new infectious diseases that we're going to be seeing on an ongoing basis. So I look forward to working with this group on the tooling, because it's really all about the voluntary empowering of individuals to return to life and work in a privacy protecting way that is non-repudiatable and trustable by all in the ecosystem. So with that, let me turn it over to Rebecca.
Thank you so much, Dr. Halamka. And I want to pick up on something you just shared about a new societal normal. And I think when we think about a new societal normal, we need to think about new standards. And setting standards is never a quick process. And this is particularly true when trying to set those standards across geographies and sectors. You know, it took 50 years to develop an internationally accepted standard for e-passports. But in the midst of the most calamitous pandemic of the last century, we need to move both quickly and with intention. The strength of the Good Health Pass Collaborative comes from the critical mass of organizations that have come together around a shared vision, and who, by agreeing to build or implement solutions in line with Good Health Pass principles, are helping create de facto standards necessary for privacy, interoperability, and user control. And we really do have a critical mass. When we introduced the principles paper just this Tuesday, 13 of the largest health pass companies, representing most of the market, had signed on. And that list has only grown since. The implication of this cannot be overstated. By signing on and coming together around this common table, we see a path where individuals globally can own and manage their own COVID-19 test results, disclosing those results selectively and with granular control. And we see a path where test results from a lab in Abuja can be used to board a plane in London and perhaps enter the United States via Atlanta. So given this, we wanted to take a moment to acknowledge the solution providers that have joined the collaborative. And I will read through a list, but I should say that some additional organizations have joined overnight, and I apologize in advance if anyone's been omitted. But the list so far includes Affinity, AOK Pass, developed by ICC, Bindle, Block, Clair, many of the members of the COVID Credentials Initiative, Dayon, Evernym, IBM, iProve through their support for health pass providers, Lumedic, MIT SafePaths, and the PathTrack Foundation, the Commons Project, and Zaka. All of them represent some of the best and brightest minds in digital technology. But it's not just about the solutions they've built, it's also how they've built them. We've seen impressive collaborations with medical experts and public health authorities, and we'll continue to encourage all members of the collaborative to continue working closely with the medical community to ensure that these solutions adhere to the latest guidance and can be safely adapted to meet the needs of a variety of contexts and environments. And so now it is my pleasure to turn it over to Drummond to speak to where we go from here.
Thank you very much, Rebecca. As you've heard, the core objective of the Good Health Pass Collaborative is to define how we will achieve real functional interoperability for digital health passes. Just like you are able today to use different credit cards at the same checkout terminal at a store, you should be able to use different apps or different digital wallets to present your health pass wherever you need to do it, an airline boarding gate, a border crossing, a venue, wherever. What we've created with the Good Health Pass Collaborative is a neutral forum where all the implementers can come together to work out solutions to the 4 key challenges we have to interoperability. The first one is open standards. While these are absolutely necessary for interoperability, by themselves, they're not sufficient. Many of our members that are already here have helped write the W3C standards for verifiable credentials. We know these standards allow for several different variants of those credentials, their formats and their digital signatures, in order to allow for different requirements around security or privacy or flexibility or scalability. So we must agree on the variant that we're going to use. The second key challenge, as you'll hear over and over again, is, of course, privacy. I can't stress how important it is for digital credentials containing personal health data to meet the highest privacy requirements in the world, including regulations such as the European General Data Protection Regulation, or GDPR. This means we need to agree how we're going to build in privacy by design and default from the very start. The third key challenge is authenticity. How do you prove that the person presenting a digital health pass is the same person that received a COVID test or a vaccination? In the digital identity community, this problem is referred to as identity binding, and it is the core problem that initially led to the formation of the collaborative. So we need to agree on a small set of standard ways that the authenticity of the health pass holder can be proved, again, while their privacy is respected. The last major challenge is consistent user experience. Just as travelers have learned over the last decade how to use a mobile boarding pass in a standard way, for instance, we need them to learn very quickly, how can you obtain a digital health pass? And then how can you use it or present it to book a flight or go through a gate or pass through a border? So our first job in the collaborative is to complete what we call the interoperability blueprint. This will represent our collective view on how we'll approach each of these challenges. Our goal is to publish that within the next 30 days. Then we'll be running work streams on each of these challenges as quickly as possible to reach a consensus on the solution. These work streams will conduct not just here, but also in conjunction with other existing work going on in the area, including at Linux Foundation Public Health Project and its COVID Credential Initiative, the Vaccination Credentials Initiative, the WHO Smart Vaccination Certificate Working Group, and finally, we'll be putting all these together into what's called a governance framework, also called a trust framework, for the Good Health Pass digital trust ecosystem. And on that governance framework, we're going to be partnering with the Trust Over a P Foundation, a project that's also hosted at the Linux Foundation. And to tell you more about that, I'll hand it over to John Jordan, Executive Director of the Trust Over a P Foundation.
That's great. Thanks very much, Drummond. And I'm really pleased to be here and pleased to be representing the members of the Trust Over IP Foundation, several of which are here, including Accenture, Evernym, MasterCard, and Lumedic, core members of this group. So that's really great. The Trust Over IP Foundation was launched last May and is now over 150 members worldwide, working together to build an open standard digital trust infrastructure that works for all of us. We're trying to add the missing trust layer to the internet. This infrastructure has to combine technical interoperability, how we work together on our machines to talk safely, and it also has to include the business, legal, and social interoperability, how people and organizations can know that they are dealing with trustworthy people and organizations. The non-technical half of this puzzle is called governance, like Drummond just mentioned. And at Trust Over IP, we have the experts gathered together to create the tools and models for governance frameworks. These are the rules that allow us to understand how we achieve digital trust. At the highest layer, we call these things digital trust ecosystems. And that's what the Good Health Pass Collaborative is building. So the Trust Over IP Foundation is really pleased to be hosting the task force for the Good Health Pass governance framework. And there's important questions that we need to understand the answers to. Questions such as, who are all the authorized issuers of a digital health credential? How can we build trust registries that will be delegated so that each country and region can identify the labs and places of vaccination that are actually trustworthy? It's not a theoretical question. How can a border guard know that the certificate that's being presented that was representing a vaccination that was delivered at some pharmacy in a state or a country was actually a legitimate place for that vaccination to have been delivered? That's a hard problem. The second problem, and it's been mentioned several times, obviously, is privacy. But privacy is an outcome. And there's a very, I'll sort of go out here and say there's a very important thing that I think has to be true in order for privacy to be delivered as an outcome, which is that when I, as a person, receive my credential from a trusted issuer, that transaction that occurs over the internet must be confidential. And by confidential, I mean that no one else is aware that I received that credential and that the content of that conversation is confidential. Just like when I go to the doctor's office, I expect that no one else knows I'm going to the doctor's office. And they certainly don't know what I talked about with my doctor. And there's very specific conditions under which the content of that conversation would be revealed. So on the internet, that means that I have a direct connection with my issuer or a direct connection to the place that is asking me to prove that I've been vaccinated or whatever else I'm trying to prove. And there is no intermediary involved in that conversation. We need to think hard and deeply about that particular question. The other thing we need to talk about, and it's been mentioned as well by Dakota, is inclusivity. We need to make sure that this is a choice. It was also mentioned by a doctor, I can't read the last name, my eyes aren't good enough, but the doctor from the Mayo Clinic, this is a choice that we offer our citizens. And speak a little bit about that from a personal perspective. My unusual background here is my bed. And the reason I'm talking from my bed is because 7 months ago, I entered a very small group of people where I had an accident and suffered a spinal cord injury. And now I'm a quadriplegic. And just last week and just today, I have many people coming into my house. I had 2 technicians working on my wheelchair. I had a physiotherapist and I had a healthcare worker. All wonderful people helping me. But I don't really know their status in terms of COVID. I trust that they're doing the right thing, but I don't know. Well, I would like the choice of having a device at my door that could present a challenge to people coming into my house that says, hey, prove to me you're from the healthcare authority and prove to me that your COVID status is safe for you to enter my house. And then my lock could open and they could walk in. Imagine how I could feel more safe. And there's 40,000 British Columbians that receive home care from 10,000 home care workers. You know, they would like the choice too, potentially. So there's a little personal story about how this is about more than just travel. And that's why we're so excited about this, both from the Trust of Our IP Foundation and a little plug for the organization I work for full-time, which is the Government of British Columbia. You know, we're about offering citizens safe choices, whether they're digital or not. So thanks very much for the opportunity to share this with you. Really looking forward to a positive outcome here. And we're going to work hard every day towards that goal. Thanks very much.
Okay, hello everybody, it's Jeff Poole here from the World Travel and Tourism Council. Thank you for inviting me to this webinar. As the World Travel and Tourism Council, we obviously have no particular technical or operational expertise in travel passes, but we do have a passionate interest in reopening borders and restarting travel and tourism. For all of the economic benefits that we've lost nearly 200 million jobs have been impacted, and we desperately need to get people's lives back. But what's critical around all of that is the emphasis that we put on testing and vaccines as in order to give governments the confidence to be able to reopen borders and restart travel, and also to give the travelers themselves the confidence that they will be able to travel safely and won't get held up on their journey. So everything that's been said about the Good Health Pass and the work that's been done here is quite fundamental as far as we're concerned, and we support it very much. I think there's some really great work has been done to define the requirements around interoperability and so on. But ultimately, we need to go beyond agreeing that we need all of these things to happen, and we need really tangible actions here from the private sector. So it's great to see that there are these 3 work streams underway with a sense of urgency. So I'm really looking forward to those deliverables. The point I would like to finish on, though, is something that a CEO told me years ago: what is not communicated does not exist. So we need to get this message around all of this work by the Good Health Pass collaborative out to governments in particular. I've just left a webinar of the OECD, the Organization for Economic Cooperation and Development, which is itself trying to put forward, proposing a blueprint for states on safe international mobility, and has a very significant overlap with the work that's being done here. I emphasized on that the work that was being done by this group and others in the private sector, and that we need to get that public-private sector collaboration going very strongly. And we've got an avenue open to them. But I think it's incumbent upon this group to define what it wants, and to give the answer to states and international organizations, rather than let them develop things in isolation and leave us with regulations that are very unsatisfactory for what we want. So I can only applaud the work and encourage it, and you will have WTTC's support. In particular, we believe that we can help with that advocacy work to governments and international organizations. So thank you once again, and well done. And I believe I hand over now to Christine from Accenture.
Thank you. Thank you, Jeff. I think is echoing many of my colleagues here. It's been incredible to see and experience over the course of the past year working on this challenge. Part of one of the I traveled moving back from the US back to the UK in the middle of the pandemic. Many of you who know me well will have heard me saying that, and I had to change countries, change visa, because my visa expired from the US. So it is, a personal story in the sense that it's not the wider context of just getting back to travel. Of course, is incredibly important. Tomorrow is Chinese New Year. As most of you can see, I'm of Chinese descent. It's been a year since I saw my parents. I for the past 43 years, I have not seen them. This will be the first. So getting back to travel is incredibly important for so many people in the world. But the health pass is also going to get us back to work, get to employment, all of the things that are the outcomes that we're looking for. And it goes beyond just getting on a plane, getting to the destination country, because many of us who are used to seeing each other face to face can't do that anymore at conferences. We can't, imagine all the lost billions in that space. Or I had to, as part of my job, I had to redo my employment. All my education certification, all of that kind of stuff has to be redone to recertify. I'm who I say I am. I've worked with Accenture for 11 years, by the way. So, all of that aspects makes it really difficult. And think about the fact that all of us can order stuff from Amazon, do this, do that, the other, that digitally. But all of these things that require a credential, that can't be done. You have to have a face-to-face situation. You have to sign for things face-to-face. And worst of all, with health, as many of you already said, how do we know it's really the right person? How do we know that the identity binding, as Drummond said, is if that problem isn't solved for, we will have the next super spreader event. And no one wants to infect the next plane load of people, the next cruise liner of people. It's so important that we know it is the right person so that we have the right outcome. This identity is an enabler, but the outcome is everything that we as a group are all looking for to get everyone back to a sense of what normality is, whether it's travel, whether it's work, whether it's actually just going on holiday, whatever it may be in our lives. And I think that's, Accenture fully supports getting back to that outcome and getting all of us to travel and back to our lives again by having a better identity, by changing, use this as a silver lining, as a catalyst to the market to deliver the outcomes that we want so that we have greater trust in the digital world. And good things can come out of an opportunity that can bring all of us together. And over to you, Anne, for the very important part of privacy and security.
Oh, Anne, you're on mute.
There we go. Is that all right? I have to tell you, so many of my colleagues in the privacy world are really surprised that I'm working with the Good Health Pass. And they're saying things like, why would you work with them? Why do you want to encourage different countries having access to your health data, etc.? The reality is, if you want to travel in this day and age, unfortunately, you will have to reveal whether you've had a health test, for example, in terms of COVID. There'll be different kinds of things. There's an IATA travel pass coming out. There's all these things. The reason I've chosen to work with the Good Health Pass is because they are embedding privacy by design, my creation from so many years ago, but they're embedding it right into the infrastructure of the Good Health Data Pass, the Good Health Pass. You see, it's so important to ensure that privacy is baked into this by design. Bake it into the code in such a way that personal control is retained by the data subject. Privacy is all about control, personal control over the use and disclosure of your personal information. Now, if you choose to travel somewhere in the future, you're for sure going to be asked for some proof that you don't have COVID, etc. Your options are twofold. You can choose not to travel, or you can choose to get something like the Good Health Pass, which will demonstrate that you're COVID positive free. But the thing is, you need to be in control of who gains access to the information that you have digitally available. It has to be under your personal control. Privacy has to be baked into it so that it can't be shared with third parties unknown, etc. No, you're in control. That's why I'm choosing to work with the Good Health Pass. Not because I want these passes around. That's not the point. I'm a realist. This is our reality right now, and this is where we have to work. So we have to try to preserve our privacy as best we can in all of these operations. There is such a trust deficit right now, and it's growing dramatically. We have to restore some trust, especially in these passes. The Good Health Pass, that's what we promised to do. Bake privacy into it so that at least that doesn't have to be one of your concerns. You can preserve privacy and gain from the benefits of the Good Health Pass. Privacy by design is all about win-win. It's not zero sum, it's not either or, it's win-win. You have to be able to travel, and in order to do that, you're going to have to demonstrate these things, but you need to be able to do that in a way that preserves your control. You reveal this information to whom you choose to. That's what privacy is all about, personal control. We can do this. Privacy by design is about data utility as well. If we don't embrace both, we're not going to be able to do anything, and that's not a world I want to live in. So stay tuned. We can do this, and I just look forward to making sure that privacy is strongly preserved. And now it's my pleasure to turn this over to John Walton.
John is my long lost cousin, but I'm Charlie.
Oh, sorry, Charlie. Forgive me. I'm terrible with names, and do forgive me, Charlie.
And I owe you my digital identity, and then you can be sharp and very clear on who you're addressing.
Thank you.
Listen, thanks a lot, and again for everyone that's joined and led up to this point, really do appreciate it. This journey for many of us started with a conversation back in November with Singapore Airlines, who said that critical to us in getting effective, efficient travel back is to utilize digital health pass along with inclusive answers that are not digital. So they knew they were going to have to deal with a variety of things. They knew they were going to have to deal with vaccines. They knew they were going to have to deal with health status checks, combinations. They knew because every flight they run is international, they're going to have to deal with multiple policies for entry. So they were really the ones that began to say, we've got to get to multiple implementations. And this executive told me, as long as they're standard. And he had a bit of a twinkle in his eye when he said that, because he knew there wasn't a standard, that we haven't yet brought together this broad community of health, identity, technology, travel, and government together. It's thrust on us all. And in many of the same ways that what was thrust on Pfizer and Moderna and AstraZeneca in having developed vaccines in a record time, it's incumbent upon us to set a frame for what good looks like in many health pass implementations. I think one point I want to make very, very clear for the audience is that the Good Health Pass Collaborative is nonprofit in nature. It's not building a product. It's not advocating a product. It's not in the product business. It's in the business of describing what good looks like when we have collaboration across these vertical domains that really haven't worked well together or at all, or have had the reason for it. We're thrust into this, and we've got time urgency now to flush that out, to flush out minor differences that exist within the identity community and how to do things right, within the health community, and as well within the travel community. Because I think it's critical to all of us that have been traveling, need to travel for work, or want to be traveling for pleasure, that we've got an effective vehicle that's interoperable at the endpoint. Now, to point out why this was called good and not perfect or better or best, is that we need something that works, and we need to get there quick. It needs to be good. It doesn't need to be perfect. And I think that's exceptionally important. I was talking to John Halamka earlier in the week, and he made mention of the importance of how organizations in both the tech financial services community, where I from MasterCard am part of, from travel, can begin to find new lights that go off through collaboration. And that really rings very, very true for this problem. This is not a problem the healthcare community, the identity guys, the travel people can solve. It's a collaborative effort. And it's really why Dakota and the team have stepped forward in an amazing way and in record time to have brought Good Health Pass to bear. Now, very appreciative as well of the collaboration of the Trust Over IP Foundation, where we see a lot of great work going on with respect to trust frameworks and how this stuff gets governed. It's a critical matter as well. And we're super thrilled to have the support of John and the VCI community, the COVID Credential Initiative community as well, WTTC and other nonprofit organizations, and in their work on privacy, the ICC, the ACI, and a number of others that are about to join in to say, let's link up, try to get the blueprint defined for what good looks like, and then get to the point of great organizations that Rebecca had mentioned to start bringing those to bear. Those are going to be different. They're not all going to work the same, but hopefully at the edge, we're able to accept in a consistent manner. So with that, I'd like to just say thanks. Drummond has mentioned the 3 work streams that are going to be going on. Best to reach out to the folks at ID 2020 through info@goodhealthpass.org to, number 1, show your support. Get your company's logo up on the website as an organization that subscribes to the principles, the vision, and the direction. That's number 1. Number 2, if you've got experts and want to begin to contribute, that's a thing to kind of volunteer for, to get more involved. And if it's merely one of saying, I want to see the results to confirm, to provide review and answer, that's another role. So do reach out to the ID 2020 team at goodhealthpass.org. I think with that, I'm going to turn things back to Ethan, who's going to run through some of the questions that have come in. If you have questions and you haven't got them in, get them into the chat, and we'll take it from there. Ethan.
Great, Charlie. Thank you very much. I think, one of the questions that has sort of been a repetitive theme here is, from an equity perspective and a digitally constrained nations and regions perspective, how do we plan to address this? Is this just about digital IDs on phones, et cetera? So I'd like to punt that one over to Dakota and maybe Drummond to speak to that.
Sure, I'm happy to say a few words, but I actually think I will turn it over to Drummond and to Jim. So, this is a foundational principle of ours. We need good health pass solutions that work for everyone. And I think that almost everyone has a scenario where they want to use something that's a little bit lower tech. Even my friends and family who are incredibly digitally enabled, there's going to be moments when their phones die, whether they're sitting in some place with low connectivity, where they simply have just decided that, they want to present something that's a bit more analog. And so what we're working on is technical standards that would permit verifiable credentials that could be presented in multiple different formats, including on paper. And so I realize it sounds interesting to be talking about, good health pass and the sort of digitally enabled test results, and then saying, the use of paper might be important. But, through use of QR codes that can selectively disclose only very specific pieces of the information, or nothing more than the fact that somebody was recently tested and is sort of good to go, there's a way to bridge the gap between, solutions that are easily presentable and low tech, and, the solution that someone might want to use who is, using their smartphone and kind of eager to have all the bells and whistles. Jim, did you want to jump in here as well?
Thanks. And I think that was a great commentary, Dakota. Even just considering those cases where somebody does have access to a digital credential, but prefers to use or wants to keep as a backup the paper copy. And topics of the digital divide and digital inequities are a challenge. And I think some of the panelists have touched upon how COVID-19 has exacerbated that. But to emphasize one of the aspects of Good Health Pass, it is that governance framework, which is pulling in not only just some specific technology solution or consideration of technology solutions, but accounting for any portion of the population that may or may not have access to digital resources, and how do we ensure that the framework of standards and guidance for those individuals are encompassed as part of those governance requirements, either at a local level, a regional level, at a country level. And Drummond, I know that you're actively engaged in some of that with the discussions at WHO, if you had something else you wanted to comment as well.
I did type an answer to that question, but I want to reinforce there are all the different work and collaborations that are going on around the world to solve this problem. I don't know of a single one that is not already decided they have to have a paper, the low-tech version of the credential, as well as the digital version, and it should always be a choice for any individual, which one they want to use, or both. My wife, who recently got her first shot, came back with a piece of paper that she came to me and said, "Really? Is this all I get? Is this the only thing I improve?" And I said, "No, dear, that's what we're doing. We're building the solution you'll be able to use on her phone." But her very next question was, "Well, what if my battery dies?" Right? And I said, "There you go, dear. You need both. You will want both." And so we have to have that covered. And as Jim says, we also need the governance frameworks that will ensure that both options will be available and they will be treated the same way. And again, we can't create rules for governments, but we can suggest this is a good way to do it and encourage them to follow through and make that their policy.
Excellent. I'm going to address this one to Dr. Halamka. Test quality is quite variable. What's the scientific threshold for inclusion of any particular testing parameter, e.g. home, point of care, et cetera? How often and by whom will the threshold be reassessed for evolving strains over time?
So here's the interesting question. Do you want to incorporate in the credential itself a judgment of the appropriateness of the credential? I would argue you don't. Right? The credential simply says, I had this test and it was this result. I had this vaccine and it was this kind, right? So as I talk about this ecosystem, and this is very quick, and I apologize for this slight digression. Think about it. A clinician orders a test or a vaccine in an electronic health record. The data from the electronic health record goes to like an immunization information system or public health entity. Then that immunization information system has to expose that data in some secure, privacy protecting fashion to some kind of credential. And that credential could be through the provider or it could be the consumer directly. Think about this whole chain, right? It's lots and lots of moving parts. And at the end, the credential verifier will submit whatever it is presented to them and give you a green check mark. I can tell you the travel industry has zero desire to keep your health data in their systems. Zero. So I would argue this trusted credential simply presents some facts. It goes to some sort of back-end validation mechanism, and the validation mechanism says you're in or not. And the rules about what is acceptable might change. Because, as you say, it turns out that tests have various qualities. PCR is a gold standard, antigen maybe not so great for some circumstances, but that can't be embedded in the credential. The credential is just the facts.
Great. I'm going to address this one to Drummond. As non-reputable and not limited to travel, but also work, public events, et cetera, is there anything envisioned for binding identity binding, et cetera?
So as I mentioned, identity binding, we consider it sort of the penultimate challenge that needs to be solved in terms of interoperability. And one of the key issues, it's really black and white, and this has again been discussed in multiple forums, but especially the World Health Organization as it's looking at smart vaccination certificates. There cannot be a requirement that you have to provide identity in order to get a vaccination, right? It's more important that you be vaccinated than you identify yourself to some standard. Obviously, it's if you can be, and there are many systems that will be able to adequately identify you such that you can get a credential and prove it really was you that got the vaccination. But there are also going to be circumstances where that didn't happen, right? And so there need to be ways then subsequently to prove. I call it the notary approach, that someone who's trusted, be it a health authority or someone else who's able to confirm, yes, it was you that received that test or that vaccination. And so you can get your credential that way, again, paper or digital. And there have to be a variety of ways to do it, because around the world, the infrastructure for both providing the credentials and then, as Dr. Halamka said, having that record go into electronic health record and into a immunization information system, they're different every place, and not all countries have the same infrastructure, yet the whole world needs to be vaccinated and protected. So we have to simply accommodate the different ways to do it. And this is, again, one of the tools of governance frameworks, is that you can say, here's our overall rules, but here's how you can adapt them in specific countries and jurisdictions around the world. And as long as they're all transparent about, here's how we're doing it, and here's what goes in that credential to describe how it was done, then everyone can make their own decisions about what they want to trust. And that's the best we can do.
Great, thank you, Drummond. I'm going to consolidate a bunch of different questions here into one, which is that folks are interested in learning more about, there's a variety of different initiatives and efforts underway, VCI, CCI, the work that's happening at ICAO, the work that's happening at WHO. How do we interact with that, and what's the relationship between these various efforts, and what makes this effort unique? So I will push that one to, I don't know, Drummond, Charlie, whichever of you'd like to cover this.
Okay, Ethan, maybe I'll start, and I'll turn a couple of points to Drummond. If folks have read the vision paper, there's I thought a wonderful depiction of the aspects of what Good Health Pass may mean in one of the later figures, and it's really the representation of a rope and its strands, and it's really the strands that represent unique sets of work going on in the community. So the Good Health Pass collaborative is not going to invent what a vaccination credential looks like. That good work is being done by health experts in consultation with the WHO. There's been great work that's going on right now within the vaccine credential initiative. There's work that started within Linux Public Health related to the COVID credentials initiative, and we've got outreach in each of those three areas. So that maybe is number one, Ethan, that we're seeing really what we're trying to do to point to the best of those strands kind of coming together. Number two, with respect to organizations in the travel industry, we've heard from Jeff today, and we've heard in our media outreach from ACI. We've been in lots of discussion with IATA. We're also have been in dialogue with ICAO in some of the technical work group, and we'll be addressing that group, in fact, next week on Good Health Pass. And then I think there also was a question on other organizations such as Oracle and others. Oracle, as many may know, is part of the vaccine credential initiative, and through our liaison with VCI, we're really hoping to build the bridge with those sorts of organizations. So I think what's very, very important is we're trying to make this really the strands of the rope coming together cross domain to bring the best of, to fill the gaps, and really to create a holistic recommendation into the community for Health Pass kind of at the edge. So Drummond, maybe to you if I've missed anything.
I know I think you labeled all of them. Some folks looking at or might have the question, well, how are you going to collaborate with them? And what I'd like to say is each of the work streams where we are trying to arrive at an interoperability decision will work with the experts in that space, whether they're here in the collaborative or whether they're in another initiative, right? We're about solving the problem and in the most efficient way possible. What we won't be doing though is outsourcing someplace else the critical elements of what must be, in a good health pass. And I'm going to, once again, point to Anne and say, privacy by design is, a lot of people say, oh yeah, it's just a term. No, it actually means you design it, you build it in, and you make sure the whole system architecture, and you can defend to anyone. This is how we protect that privacy. So that's one work stream that combines all the rest. When we get the rope wrapped together, and I like to put it, one reason Anne is here and the privacy expert community that she represents is because we want to be able to hold it up and go, this is, does it work? Is this really going to provide the control that that she talked about? And we're going to be very public about that, right? We're not going to hide any of these recommendations. You're going to be able to read it in that governance framework. And Anne, if it doesn't, if we don't meet the test, you're going to tell us, right?
And if I could add, Drummond, thank you for mentioning that. When we talk about privacy by design and privacy as the default setting, which is the second foundational principle of privacy by design, that is a game changer. Privacy as the default means you don't have to ask for privacy. You get it automatically. It is embedded as a default setting in your operations. It's baked into the code. So it's not something you're going to forget. It is an essential component of the design, and that's absolutely critical. And Drummond knows me. I'll have my eyes all over this all the time to ensure that that's upheld.
Ethan, you're on mute.
Sorry, apologies. So fantastic discussion. We are getting towards the end of our hour here together, and several people have asked questions about how they can get involved and engaged with the collaborative. I'm going to kick this one to Dakota, and then if Charlie, if you'd like to add in, happy to have you do so.
Fantastic, thank you, Ethan. So the Good Health Pass Collaborative is meant to be open and inclusive and represent the best of many, many sectors. And frankly, the task before us is both incredibly exciting, but also quite daunting. With the aim to get guidance out there and standards written within a month. This is a timeline, I think, pretty unprecedented, to use a perhaps overused word. And so with that, we need your help, we need your participation, and we want to do this in an inclusive a manner as possible. So we welcome the participation of organizations in the travel, health, technology sectors, those who are working in sort of adjacent verticals, as well as policymakers, government agencies, NGOs. Essentially, if you endorse the principles outlined in the Good Health Pass vision paper that we published on Tuesday, we want your participation in this. There are essentially 3 ways to join. And please, I'd say the first thing is, if you're interested in joining, please reach out. We have a website, goodhealthpass.org. There's a form there that you can fill out to register your interest, or as Charlie mentioned, you can email info@goodhealthpass.org. And then, essentially, if you're interested in simply stating your support and endorsing the principles, that's incredibly easy to do. We want everyone to join in. If you're eager to get involved in a more active way, please, again, reach out. We have working groups that are ongoing and working groups that we are going to spin up. And we will ensure that you are plugged into those working groups. So don't hesitate to reach out to me or to the team or to other members of the Good Health Pass Collaborative that you may know. And we will all work to solve this very significant challenge together. Thank you.
Great. Thank you so much, Dakota. So first off, thank you to everyone who joined us today. We're really, frankly, overwhelmed with the amount of support that we've received over the last several days, and look forward to working with everybody. As Dakota noted, contact us through the website, and we will route you to the appropriate person, and look forward to some exciting months working together. And with that, I will call this to a close, but thank you and have a great rest of your day.